A good bounce. Payne has a real job to keep this in play. How good is he, though? There is real concern for Luke Cavell. He's in all sorts of trouble clutching at a right knee, I think.
It's the moment all players dread. A knee giving way, a season ending far too early.
First thought that came to mind was that was it. I'd come off contract, I knew I was coming off contract at the end of the year, and when I was getting carried off the field, because I knew what I'd done without having the doctor to tell me, and I thought it was all over.
When Luke Cavell snapped his anterior cruciate ligament in round 4, he didn't realise he'd make rugby league history. Playing in the final season of his contract, the 29-year-old winger thought the curtain had fallen on his professional career.
Very daunting. I just couldn't get out of my head that, that was the way everything was going to finish.
Cavell required a knee reconstruction, an operation that usually requires 6 to 9 months of rehabilitation.
I guess the initial thought was, that might be Cov's season, until we got talking and the phys threw up the idea of the LARS ligament.
The ligament augmentation repair system, or LARS procedure, had been successfully performed on Sydney Swans player Nick Malceski, but no one had tested the surgery in rugby league. Cavell turned to Dr Craig Waller for help. The orthopaedic surgeon has done more than 4,000 knee reconstructions and was confident the LARS procedure would have the winger back before the end of the season.
The recovery from this is easier and it's faster. So with traditional ACL reconstructions using, for example, hamstring tendons, the players are out for a season, minimum 6 months, but it's often 9 months and can be up to a year.
This is the first time Dr Waller has spoken publicly about his work with Cavell, and he invited us into the operating theatre to witness this revolutionary surgery.
In standard classic ACL reconstructions, we'd remove all of the cruciate ligament remnants and replace them with hamstring tendons. With this procedure, we're going to preserve them and reinforce them with the LARS ligament. The breaking strain on this is 450 kilograms, or well over 1,000 pounds in the older scale. So this is it. We're going to thread that up. This bit is going to be in bone. That porous bit is the scaffold along which the anterior cruciate ligament is going to heal and reattach. That's the porous bit there. And this bit will be in bone, and we'll hold it in bone with some screws, and the rest of it we'll cut off and throw away.
The surgery takes less than an hour, and like Cavell, this patient will be walking without crutches within a day. Leaving the hamstring intact is the key to the quick recovery time.
With this procedure, you can be back running with the teammates in 3 weeks. So you don't get the muscle wasting, you don't get the hamstring strains, you don't get all the swelling, you don't get the area of numbness. They're back training very early.
I think we sort of sat down and we had Cov planned to run in about week 5, and going off your standard guidelines, I don't think that's probably till about week 9, week 10 even. So, but we planned for Cov week 5, and we had him going in week 3. He was back doing some sneaky running.
Now back to full strength, Cavell hopes to return to the NRL. He's already played in the New South Wales Cup, taking to the field just 10 weeks after his surgery.
I was absolutely terrified. I couldn't stop, moving all morning, and was just thinking, I hope this works, I hope this works. And once I had a couple of runs through the game, the sort of confidence was building and got back, and it just felt like it was pretty much back to normal.
The difference between having a player out for a few months and losing them for a year could have a major impact on a team's fortunes.
I think this is going to be a game changer, and I think that nobody wants to take a year off sport, especially the professionals, and it gets you back within the same season.
I just want to make sure that I get the rest of the year out and finish the way I want to finish. Back playing footy is all I wanted, and I got given the chance.